People are candidate for Invisalign are ones who have crowding, gaps in between the teeth, or misalignment of their teeth. They're looking for proper function and proper cosmetics. Most people are candidates for Invisalign. Usually from young teens to late adulthood, I've had patients who are 90 who have started Invisalign with me. The biggest thing with Invisalign is to offer proper alignment of teeth so that you're able to chew properly, not putting unnecessary pressures on certain teeth that will cause you these teeth to fail down the line. Invisalign can work on teens. We've had patients from early teens, we're talking about 11, 12, as long as they are wearing the aligners and following the proper protocol and then following up with the dentist, we ensure that these teeth are moving safely and being able to correct any bite alignment issues for the patient. Teeth may prefer Invisalign compared to traditional braces because it is discreet, convenient, and they're able to remove it effectively. With Invisalign, it's sometimes just a more convenient option where they don't feel like they have to show the metal braces to other people. They're able to take it off and able to brush and floss easier. Patients often ask me how long Invisalign takes. Invisalign is dependent on the case itself. It can last from a few months up to 18 months depending on your bite alignment, concerns that you have, but it is very effective in solving these issues very quickly. Taking care of Invisalign aligners is very easy. We offer all the necessary protocols to make this as smooth as possible for the patient by brushing the aligners to remove any debris or bacteria onto them, removing them when you're eating or drinking anything that is staining other than water. You'll brush an Invisalign aligner by using a soft to bristle toothbrush with a non-abrasive toothpaste or soap used to be able to remove all the debris effectively. You are taking off the aligners when you are brushing. You are going to be brushing your teeth regularly as you always do, able to floss regularly as you always do. The only extra maintenance that requires is also brushing the aligner itself and cleaning them. Invisalign is a better solution than Smile Direct Club is because Invisalign is supervised by the doctor themselves. We constantly do checkups to make sure that the teeth are moving properly and safely and we are achieving the results that you want to achieve. I always urge patients to not go through Smile Direct Club or any cases that are similar to that. And the reason is that these procedures are not supervised by the dentist. You really need to be able to trust your dentist in making sure that these teeth are moving effectively so they're not causing issues down the line. With Smile Direct Club or any related companies, they're not supervised by the dentist and there's no one there to oversee the case to making sure that you are getting the care that you deserve. Invisalign can support airway health by expanding the arch, allowing the tongue to sit properly and allowing more teeth alignment in place. Patients who are grinding their teeth or clenching usually is caused by airway issues. By having an Invisalign, we are reducing clenching, we are reducing grinding, we are reducing jaw discomfort, and we're opening up the airway, which allows the patients to be able to breathe better and speak better. Invisalign is very important in regards to airway health. If you're a person who does a lot of strenuous activity, it requires more oxygen to go into the body. If you are doing Invisalign, we're able to effectively open up the airway, allowing you to breathe better and being able to perform daily activities as well as sports or any exercise activities. I always tell patients that with Invisalign, the aesthetics is a plus. Invisalign is designed for function and aesthetics, but it's mainly to make sure that we are reducing clenching, grinding, putting teeth in the proper alignment so they're lasting for as long as possible. They also do protect dental restorations. When you're putting unnecessary pressures on teeth or any restorations that you have, you are allowing them or submitting them to fracture more easily or breaking apart. This becomes more costly down the line as you're going to have to fix those restorations or having to fix teeth that may have been broken. With Invisalign, it is definitely the more conservative option because we're reducing any of those unnecessary pressures and making sure that your restorations last for as long as possible. With Invisalign, you can drink water while wearing your aligners. With anything that stains your teeth, such as coffee or juice, you want to remove your aligners so they don't stain right away. It is very easy and convenient to remove your aligners so you're able to drink the stuff that you want to and it doesn't affect your day-to-day life. It is preferred not to be drinking soda water with the aligners, and that is because with the increased carbonation, we don't want to risk any decay or any acidity onto the teeth as the aligners can trap that. Invisalign takes relatively short amount of time with great clinical expertise when you make sure that the teeth are moving effectively and safely. I've had patients that get their results in the span of a few months and correcting any crowding issues, bite alignment issues, and it enhances their smile right away.